The Clear Healthcare Communications Task Force, we used to actually call ourselves the Health Literacy Initiative, but that term really puts the onus on the patient. Patients, how health literate are they? But really, the onus should be on the industry to make things easier for people to understand. So our objectives are to educate our membership and elsewhere in how things should be made more clear so that we can have easier decision points and then therefore have better health outcomes. It's been an evolution of our process. It was first more about awareness, making sure people understood what the problems were and things that they could do. And then the next phase was more about the basics. Here are steps you could take as an organization to make things better for people. And now we're really at the point of rolling out tools that are available publicly and training the membership on how to use these tools. And so we're hoping that the next stage will continue this evolution of tool use, but throughout different areas. So whereas one focus is more on the discussion guides, the stimulus, or the screeners that are going to be used, the next phase will be more on culture. And then hopefully the next phase after that will be hands-on with moderators. So we want to make sure that everyone has the ability to make good decisions for themselves to have better health outcomes. And the question is, how do you get to that? Traditionally in our space, we screen out those people that really could use the help, because we don't want someone that comes into the research that has a heavy accent or isn't good at doing something creative. We are trying to bring the awareness that we should be focusing on everyone. If you're addressing those people that have lower health literacy, making sure things are clear, then everybody actually gets a boost. What I'm passionate about here is that we're really have an end in mind of the patient and how they can have health outcomes that are optimal. And we are a very democratic, flat organization. We all volunteer for what we want to do. We have little projects that we pursue and teams assemble to execute those. People move in and out of their ability to work with us. So we don't put a big time pressure on anybody who doesn't really come into it. We have monthly meetings and people show up or don't show up. They commit to things or they don't commit to things. But what we find is that within a year, we do a lot of great work. We end up with 1 or 2 trainings a year, often 1 or 2 articles published a year. So 2025, we're already looking at the training we're going to be doing on tools, as well as some work we're going to be doing on culture. And then we're actually starting to think about the research that has to be done this year for any trainings in the future. So we've already started looking at some of the studies we want to do. I think one of those is going to be around when patients feel they are misunderstood by their doctors, what do? Do they move on to a different HCP? Do they go to a non-traditional outlet? Do they simply suffer, or do they try to treat themselves? So that's the next study we're looking at. Back in the day, we looked at labels, and if we made some modest changes, could people improve? And in fact, we saw improvement not only to the lower health literacy group, but also to everyone. So we thought, well, these basic changes are really needed for all people. And then we moved on to another phase of the research where we're going to do some qualitative work. First, we studied patients to understand their needs and their challenges. We recorded those and turned them into video vignettes. Then we showed the physicians some of these videos to try to see if they knew which of the patients were higher versus lower health literate. And guess what? They're not very accurate. So just because they think they know, somebody comes in looking a certain way or whatever their judgment is based on, they're not very accurate about that. Again, meaning that they should really treat everyone in the same way, giving everyone very basic information to start off with. We're moving into the next phase, which is going to be on training with specific tools, so people can literally bring their laptops to sessions and put in information and find out, oh, there's a problem here, and here's where we can fix our materials. I think, inclusion and DEI is very important, and obviously, it's under attack these days. What we focus on and have always focused on is how to make sure that healthcare communications are clear for everyone so that we all understand our choices and have better health outcomes. And I really think that that kind of puts to the side DEI because people are attacking it and not even understanding what that means or what it is. And so I think by staying focused on what we've always focused on, which is health literacy and clear health communications, I think it bypasses any arguments that people may have. Because in reality, we're just trying to provide something for everyone to understand and to have better health.